Supraventricular tachyarrhythmia. Supraventricular tachyarrhythmias include all tachyarrhythmias that originate in, or incorporate, tissues proximal to the bifurcation of the bundle of His. The diagnosis requires an atrial rate greater than 100 per minute, while the ventricular rate may be less, when atrioventricular conduction is incomplete. Supraventricular tachyarrhythmia is defined as 3 or more consecutive supraventricular premature beats, at a rate greater than 100 per minute. Paroxysmal supraventricular tachycardia, PSVT, is a clinical syndrome, characterized by the presence of irregular and rapid tachycardia, of abrupt onset and termination. These features are characteristic of atrioventricular nodal reentrant tachycardia, AVNRT, atrioventricular reentrant tachycardia, AVRT, and atrial tachycardia, AT. Sinus tachycardias, ST, atrial fibrillation, AF, atrial flutter, AFL, and multifocal atrial tachycardia, MAT, are considered special separate entities, although AF, AFL and MAT may also be paroxysmal. QRS complexes in SVT. Narrow QRS complexes are usually seen in SVT. Wide QRS complexes will occur in cases of 1. Aberrant intraventricular conduction, also called transient, functional, or rate-dependent bundle branch block, BBB. 2. Coexisting BBB. 3. Conduction of the tachycardia in a bypass tract, also called pre-excited tachycardia. Causes of aberration. 1. Tachycardia or acceleration dependent. 2. Bradycardia or deceleration dependent. 3. Concealed transseptal conduction, where the impulse traverses the septum, and depolarizes one bundle branch, rendering it refractory. Clinical classification of supraventricular tachyarrhythmias. 1. Paroxysmal cases, tend to be recurrent and of short duration less than 1 day, seconds to hours, for example, paroxysmal SVT, AVNRT, AVRT, AT, paroxysmal AF, and paroxysmal AFL. 2. Persistent cases, may last for days or weeks, for example, sinus tachycardia, ectopic non-paroxysmal AT, MAT, and longer episodes of SVT or AF or AFL. 3. Chronic cases, do not revert if untreated, often fail to revert with attempted treatment, and if reverted will frequently recur despite therapy, for example, chronic AF, chronic AFL. We have got a very big list of SVTs depending on the site of origin. 1. Sinus node origin, standard sinus tachycardia, inappropriate sinus tachycardia, sinus node reentrant tachycardia, and postural orthostatic tachycardia syndrome. 2. Atrioventricular node reentrant tachycardia, AVNRT, typical, slow-fast, AVNRT, atypical, fast-slow, AVNRT, and slow-slow AVNRT. 3. Bypass tract-mediated atrioventricular reentrant tachycardia, AVRT, orthodromic slow-fast AVRT, orthodromic slow-slow AVRT, and antidromic AVRT. 4. Non-reentrant junctional tachycardia. 5. Atrial tachyarrhythmia, reentrant, paroxysmal, atrial tachycardia, AT, ectopic, non-paroxysmal, AT, triggered AT, multifocal atrial tachycardia, MAT, atrial flutter, AFL, and atrial fibrillation, AF. Thank you.